Shabab, just settle down, please. Okay, Shabab. Mobiles aside, please. All of you. Take care of your mobiles, please, all of you. Okay. So one of the leftover lectures, it's about the mammary gland. We did not discuss this issue before. It's a fairly simple issue, and we'll finish it quickly, inshallah. Physiology of the mammary gland. Thank you. Let us have a look at the objectives which are written there, first of all. And you will see that we'll have to see how physiology goes on in a normal development of the breast, number one. Okay? Then we'll move on to the issues of the pregnancy and then lactation. Our main target is that how does the breast prepare itself for lactational purposes, okay, and for producing the milk and maintaining that milk for a certain period of time. That is the most important point, okay. And we'll talk about the processes which are involved, or the reflexes which are involved in the milk secretion and milk ejection, okay. That will be the target of our discussion. I'm sure you are familiar with the anatomy of the breast tissue, that it's a complicated modified gland derived from sebaceous glands, and an adult breast has a typical morphology. It has the stroma and the parenchyma. You have stroma, which is the supporting connective tissue, and the fat which is there. So the stroma is formed by the connective tissue and the deposited fat inside. Well, the parenchyma is definitely the glandular system along with the ducts, okay. So the ductal pathways and the final glandular areas, the dilated acini, they form the parenchymatous system, which is lined with the epithelium, and that is capable of producing the milk, or that is capable of maintaining the secretions. We'll see, okay. So finally, from these sac-like structures which are made up of the epithelial cells, you are forming the glandular tissue, and then you are draining into the ducts, and finally one duct arises, and that is a lactiferous duct, and that lactiferous duct opens into the nipple. Many lactiferous ducts, they come from different areas of the glands, and they finally traverse to the surface. They find their way and they open through a common opening, or sometimes more than a common opening, and it is over the surface of the nipple. Here you can see multiple lactiferous ducts are coming, and they are opening here over the surface, okay. So we have to keep this morphology in mind. The development of the breast goes back really in the embryonic life. A primitive milk streak develops in the region of the breast, male breast and the female breast both, but that gland is kind of undifferentiated, or really it is not significant to differentiate between male and female gland till a particular age. Before the puberty, it is not important really, okay. At the time of puberty, you will see some changes in the structure. Even in before puberty, there are some changes happening in the female structure, slightly more than the male structure in preparation. But finally, puberty is the deciding point, that what will happen, what is going to happen, okay. Hormone responsiveness develops in the female mammary gland, okay. That is the female breast, and inside that the mammary gland is there. In the male breast, nothing will happen really. It will remain rudimentary. Our breasts, they also grow at the time of puberty slightly, okay, but not like a female, definitely, because they are not hormone responsive, okay. This is how the embryology or developing. You see that the streaks or the milk lines develop on the embryo. The whole milk line develops, and later this line regresses. It becomes smaller, 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 and you will have two little areas left here in the form of the remnants or the mammary buds. Milk streaks will be converted into still little buds in the thoracic region, both male embryo and the female embryo. Okay. I don't know if you have seen or not, but some of us, sometimes, males or females, when we are embryo, we have the line, complete line, okay? And that line has to disappear, only this region has to be left for the development of the mammary gland, right? Okay? Sometimes, some persons, some of us, perfectly normal, we have over our skin, okay, a little nipple-like structure or a mammary gland here, and one is mojood here along that line. Because sometimes in some of the embryos, it fails to completely obliterate and more than one remnant may be mojood here, okay. It is kind of an abnormal thing, but it remains as a memory of what happened in our embryonic life. So sometimes in the abdominal region, person has a nipple-like structure or a gland, and that is in line with this mammary gland. So an additional mammary gland or a little structure may be present over there in a female, or a breast-like structure is present here, a nipple-like structure, or a similar dark area is present, which reminds that, oh, it was the level of that line along which the mammary gland will develop, okay. Look, the surface epithelium, the surface ectoderm is going inside, okay. There is moving normal ectoderm here, and you will see invagination of the ectoderm, and you will see further development. So it's a fusion of the ectoderm and the mesoderm, and they will form together the mammary gland. Developmentally, you have got two things. From the surface, you have the invagination which is coming, and this is developing. So some of the part is developed by, look at the areola of this structure and the nipple structure coming from the surface ectoderm. And the rest of the part, your gland, the glandular epithelium and the ductile system, that is coming from the mesoderm. So it is a perfect combination of ectoderm and the mesoderm that we have, okay. That was about the embryology, okay. Now, before I go to the lactation physiology, let us very quickly recall those changes at the time of puberty when a female is developing, and that female shows the breast budding, you know, and then over years a complete stage by stage development of the mammary gland. A full-fledged gland develops over few years actually. By the age of 17 or 18 years, the full morphology, full structure is developed. Complete fat deposition, complete parenchymatous growth, ductile system, which is necessary for the puberty time, okay. So that is the pubertal development of the breast, and that is known as thelarchy, okay. The whole process of the thelarchy happens and the complete development, okay. Let us go to the hormones. What is doing what, okay, or who is doing what, in that other sense you can say. One by one, the first building block or the first construction evidence will come from which hormone? You will begin with the estrogen, because the basic blocks of the stroma, to make the supports or the foundations, you need stroma and you need to start developing some fat, and that is done by the estrogen. All right, okay. Now, because the monthly cycles have started, estrogen is followed by the progesterone. One after another, both will come. You cannot stop. Awwal estrogen will come, and after that progesterone will come. So both will do the job. In every cycle, you are building a breast. In every cycle, every month, you are slowly developing a breast, isn't it? So it takes a gradual change in the contours and the size and the shape of the breast, and that's why it's a slow process. Every month you have hormones, then they disappear, then they come, then they disappear, then they come again, and that goes on for years actually, okay. So you need some time for the breast. In one cycle, in few cycles, don't expect that the full growth will happen. It's quite logical really, okay. Now, estrogen, progesterone, the job of progesterone. What is the job of the progesterone, by the way? Quickly, you know it. Yes. Now you are focusing the glandular system, okay? Glandular system. Are you focusing the ducts as well? No. What are you leaving ducts for? Okay. So in the first part, you did two things. Number one, okay? When you are building an Imara or building an area, okay, a complete colony, what do? First of all, you make some inroads, okay? And you make some structure or leveling of the ground here and there. So it means you are making stroma and you are making the roads also. These roads are the ducts actually, isn't it? So that issue, the ducts are done by the estrogen. That side job of leveling down things and developing stroma and the framework, it is also done by the estrogen. Now you are left with the final houses or the factories which will make milk in future. Those factories are the glandular areas, the acini or the alveoli, isn't it? Give that job to, and you know that, okay? So progesterone is responsible for developing the alveolar secretory epithelium, okay, the growth of the glandular structures. Plus, progesterone will also do the other jobs. It will take care of the lining of the duct also, no problem, and it can help in some fat deposition also. So it will add to other things also. But the main jobs are distributed here and there. Well, that was the main thing. But Shabab, these are not the two hormones only which will develop the breast completely. Even if you have these hormones in a very good amount, a good concentration is there, breast will not develop completely in a female at the time of puberty if you don't allow some other hormones. Can we have those hormones also? What are these hormones? Okay. Prolactin will add a little touch to the epithelium but not doing the main job, okay? Go to some other hormones which are zaruri, which are very, very essential. How can you forget, yeah? Growth hormone, number one. All breast, all tissues, every part of the body depends on growth hormone, isn't it, for the growth? So awwal, you need for grounding, for making the cells and development, generally you need growth hormone. That's one thing. What else?
Insulin-like growth factor.
Insulin-like growth factor. If you have growth hormone, you will have insulin-like growth factor automatically if growth hormone is mawjood, because it will come from liver. Okay, IGF-1 will come from liver. So two are working together. Growth hormone and IGF-1. Khalas, one group. What else? Yes, Abdullah? Thyroxine. What else? Which adrenal hormone, my dear? Glucocorticoids. Lovely. I'll take these two answers, lovely answers. One is thyroid metabolic hormones and second is cortisol, yani glucocorticoids. Thank you. Great. So these are the hormones. Still we are left with few or one at least. Come on. Gonadotropins will drive other hormones like estrogen indirectly, yes, okay. These hormones are acting directly. Cortisol is acting directly, growth hormone is acting directly, thyroid hormones are acting directly, isn't it? And one more. Sure. We are talking about a pubertal female, huh? So we are talking about LH. We can talk about LH for progesterone. We can talk about FSH for estrogen. Khalas? Okay. What else? Directly. Progesterone is already there. You have told about progesterone. No. Come on. From your own body. From our bodies. We are talking about females. Come on. From your or me, I mean, we are talking about humans. Okay. We are talking about females. It's about the issue of the pubertal development of a female breast, isn't it? Prolactin is there, a little function, a finishing touch, slightly. Oh yeah, great, thank you. Insulin, why are you forgetting insulin? Come on. It's a pure, gentle metabolic hormone. You can't keep insulin off. So you need at least arba. These four hormones are very important. Insulin from one side, thyroxine from other side, or thyroid hormones, growth hormone and IGF-1 from other side, and cortisol group of hormones from the other side. These hormones are called the metabolic hormones, okay, and these hormones are called the permissive hormones because they allow the estrogen and progesterone. Awwal, the foundation will be developed by these hormones, and then you will have the estrogen coming and progesterone coming, and then they will do, and then you will have the prolactin, and then when the pregnancy comes, some more hormones will come. Khalas, no problem. But first of all, you start building the basic foundation blocks. So you say, okay, I'll put 4 blocks. I'll put growth hormone, I'll put thyroxine, I'll put insulin, I'll put cortisol, at least 4, along with the other supporters. And then over that, I will put estrogen, and then I'll put progesterone, and I'll add a little prolactin also to it. And then later in the future, I need some more hormones. But at the time of puberty, this is the situation. You need some special metabolic supportive hormones or the permissive hormones, and then you need a special developing hormones, and the best hormone for shaping up the breast, as you all know, is estrogen, and that is called the priming factor or priming of the breast. So the priming of the breast is done by, the shaping is done by estrogen. The final additions are done by the progesterone and later by the prolactin, okay? But if you talk about the foundation hormones which allow these hormones, you will talk about metabolic hormones first, okay? So I think now the concept is clear. What do we mean by the permissive factors or the hormones? What do we mean by the real hormones which are acting on the breast? What is the most important hormone for the breast priming? What is the other hormone coming for the glandular development? And then later we will see. So the picture is clear for the pubertal area at that time. Okay. Let us now go quickly to a new phase, and that is lactation. Okay? What is lactation, by the way? What do you understand by lactation? I'm sure all of you know this term of lactation, but what do we get from this term, lactation? Yeah?
Secreting milk.
Milk secretion, okay, all right. And what else? Lactation. Lactation is not only a phenomenon, lactation is actually regarded as a period or a time period, okay? So the concept is a little different, broad. Lactation is not a process that you have the milk secretion, okay, or milk production. It is a part of lactation actually, okay? But actually it means the breast, it is the time period or the phase during which the breast starts producing the milk and keep on continuing the milk and do it for a long period of time, for mumkin 2 years or 2.5 years after the birth of the baby. You know that babies are even fed up to 2.5 years or 2 years. Some of the mothers do that. Some mothers withdraw early, but other mothers, they keep on doing it even 2 years, and it is recommended. It is written in Quran also, we know that, okay? So the time of lactation is actually mentioned, okay? That period is called the lactation, okay, in which the mother produces and continues that phase for a variable period of time, okay? Now that lactation is divided into different phases, or it is dominated by different phases stage by stage, okay? Let us see the definition of these phases one by one. 4 terms we are going to use, please. Look at the terms. We are using 4 of the terms, please. The first term is mammogenesis, okay? Second term is lactogenesis, okay? The third term is galactokinesis, and the fourth and the last term is galactopoiesis, okay? Closely allied terms having some overlap also, still they have their distinct meanings also, okay? So we have to see one by one. Mammogenesis. Apparently mammogenesis means formation of the breast, but the breast have already been formed before. You will further have an improvement in the breast in preparation of the milk really, okay? So mammogenesis means when you are reconstructing the breast or regrowing the breast for the purpose now of milk production and milk secretion, okay? So it means mammogenesis will not, in true sense, if you are taking mammogenesis as a part of lactation, then will you take it at the time of puberty?
No.
Mammogenesis in this sense, if you're talking about lactation, so will you take it at the time of puberty? No, you will not. You should not actually, because mammogenesis happens at the puberty also. Mammogenesis actually happens in the embryonic life also, because once you are developing the gland, it is also a part of mammogenesis. But actually the term mammogenesis is kept for the phase of lactation, once the mother is preparing for lactation. So mammogenesis should start from when? Yeah, it should start from the pregnancy time, not before pregnancy. So in a non-pregnant female, I think it's better to avoid this term of mammogenesis, even though the breast is mawjood and developed, okay. But the true mammogenesis for the lactation will come and will start from pregnancy, sometime in the pregnancy, somewhere in the middle of the pregnancy to the later part of the pregnancy, that will go on really, isn't it? Okay, so the first thing is clear. Mammogenesis here means something else. It is not simply the development of breast, yani. You will say, oh, development started in the embryonic life. What are you saying? Okay, so keep yourself confined to the meaning of the term here. The second term is lactogenesis, when after developing breast to an appropriate structure in the pregnancy, now you make the breast capable of starting the milk production now, okay. So you need few more qualities of the breast, and that point is known as lactogenesis, when for the first time milk starts appearing, okay. In the pregnancy, awwal you will have mammogenesis, okay. After mammogenesis, what you will have? You will have lactogenesis side by side starting, so that the factory is taqriban ready to start the milk production, okay. Galactokinesis means the process of ejecting or bringing out, okay. It means you are finally achieving your target, yani breast development has occurred, milk production and secretion has occurred, and milk ejection is now successfully happening, yani milk is coming out, milk is expressed, yani no problem, okay. You can supply the milk properly to the baby, okay. So step by step, you are starting from mammogenesis, you are going to lactogenesis, you are proceeding to the galactokinesis, okay, the movement out, and finally if you maintain this successfully for a long time, for weeks and weeks and weeks and months and months and months, then that process will be known as, that maintenance process is known as galactopoiesis, okay. So I hope the terms are clear in our mind if you are dropping down from one term to the other term, that what is the meaning of mammogenesis, lactogenesis, galactopoiesis, and before that galactokinesis, okay. So that goes on side by side, okay. It's not that one process totally finishes and then next will start, when the second will finish then the third will, they will go side by side also, but you should know the meanings of all these processes very clearly. Are we not confused about anything so far? Okay, sure. Yeah. Lactogenesis? Now let us have a question for that. In the middle of the pregnancy, if a female, okay, presses the breast sometime, do you think, is it possible to have a drop of milk over there? Now what is your answer then? Lactogenesis. Initiation of the milk production, yes or no? Yes, so it is there, right? Okay, evidence is mawjood, okay. We know shahada is there, milk is coming out, it means milk is being prepared inside, not in a great quantity, but still initiation has been done, isn't it? Yes, Ahmed?
Is it part of the mammogenesis, developing a gland, that secretion of the gland?
Well, see, mammogenesis means that you are taking the mammary gland to the level of maturity, so that it meets the requirements of milk production, okay. It has to be well developed. It is very well developed inside, maximum alveoli, maximum glands, best conditions of the ducts, everything is prepared, and factory is ready, and at the same time when mammogenesis is in the middle or it is going on, still lactogenesis starts at that time, okay.
The gland becomes mature.
Yeah, okay, and that maturity of the gland comes in pregnancy, not before pregnancy.
Produce milk.
Yes, yes.
Then milk is produced by the mammogenesis.
By? No, mammogenesis is the requirement of the future phase actually, okay. Lactogenesis can start, now that is another question, okay. Can lectogenesis happen before mammogenesis? Yes or no?
Yes.
Normally it will not. Normally. But is it mumkin? Yes. Okay.
Second pregnancy.
A young lady, a young girl, 16 years, 17 years old, and she has a prolactin secreting tumor in the brain or excess of prolactin coming. Shadid amounts of prolactin are coming in the blood, flooded with prolactin. Prolactin is now acting on the breast. She has estrogen, progesterone mojuud also. Prolactin is now coming in the picture. What condition will she suffer from? What is that condition known as? Galactoria. What is the meaning of galactoria? Lactogenesis has started. Is it normal lactogenesis or abnormal lactogenesis? But still possible. Mumkin, okay? So there are many conditions. It depends on the hormones actually. But the real time of lactogenesis is the pregnancy time after mammogenesis. It should be. Okay? That should be the tarteeb. Okay. So we are now familiar with the phases. Now quickly. Alright. Now for mammogenesis, definitely you have a very good support of some hormones. You know that. You are talking about the pregnancy. You are talking about hormones of pregnancy. You have all hormones coming from placenta in mind. I'm sure you have. Okay. What are those hormones which are helping for the mammogenesis to be completely achieved? Give me a complete picture. Give me a complete picture. I want complete answer from you. Okay. 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 What else?
Is there any more?
Which is the fourth one? Fifth one? Okay. So, do you think the foundation hormones are still important here? The metabolic hormones? They are needed? Like thyroid hormone and insulin and growth hormone. Okay. Still, you need at least their normal or optimal levels. Okay. You cannot withdraw them completely. Do you need them? First of all. So, you start from the first level. These hormones are mojuud. Okay. One thing. Over those hormones, now you build up the second layer of hormones. What is that? Estrogen. Good amount or a little amount? Okay. What about progesterone? We are in the middle of the pregnancy. Do we have a very good amount of estrogen and progesterone? The growing amount, increasing amount? We have it. No problem at all. So growth is going perfect really, isn't it? Additional supports are coming. What are these hormones? Prolactin is now present. Well, the action of prolactin is actually forbidden or it is stopped by estrogen and progesterone because they are mukhalif. They don't want prolactin to act right now. They will try to antagonize. So there is a slight role of prolactin. The free role of prolactin will come at the time of lactation after the birth of the baby actually. Prolactin is mojood. Its amount is increasing a little. Yes. Okay. But it is not allowed to work freely at that time. What are the hormones of the pregnancy? You mentioned that. Yeah. HPL. Okay. Well, that's a very good quantity of voluminous amounts of HPL are coming also, and they will also add. Now, in the light of so many hormones, imagine how would mammogenesis will go. Okay, that will be a very good mammogenesis having, and the breast size becomes sometimes as much as double. Okay, it's a complete construction, rather reconstruction of the breast. Okay. Normal breast was already mojood before pregnancy, and now it is developing size as much as twice, sometimes even more, okay, sometimes a little less, but it goes on. Okay. You know, I'm not discussing all those actions, estrogen, progesterone, you know actions all, okay. All other changes, the skin of the breast, the nipple size, the inner structures, stroma, parenchyma, all hormonal supports are mojood. So finally, a perfect mammogenesis and shaping is there. Okay, it develops, and actually the true number of alveoli develop during the pregnancy, and they don't develop at the time before the pregnancy. Even though she's passing the age and she's having estrogen, progesterone every month, she's a non-pregnant woman. No. Pregnancy will give you a true picture and a true development of the mammary gland in terms of the alveoli, in terms of the ducts, in terms of the structure. Okay? All these hormones are there. One more hormone is mentioned here, which is adding to a little support of the calcium, and that is parathyroid hormone controlling the calcium metabolism of the milk also, which is added to the picture also. Okay. Lactogenesis. A brief stay in this area. What is lactogenesis and how do we divide it physically? Okay. Let's have a look. We are dividing in this slide lactogenesis into 3 stages or the 3 phases, which you usually don't discuss, but there is a distinction. Phase 1, phase 2 and phase 3. L1, L2, L3. L1 means lactogenesis 1. L2 means 2.